it placed Ngautinja at the time at about 9%, the North Health District. But I'm happy to say that today, if I go by the PMTCT program, that's the Prevention of Mother-to-Child Transmission program, which is a program with indicators that really give out impact. As at the second quarter of last year, Ngautinja stood at 7%, which was quite an improvement. And within that period, in Babungo, out of 37 pregnant women who were tested, 2 were positive, giving a prevalence rate of 5.4%, which is below the district prevalence rate, which is quite encouraging as well. Okay, now so the situation is still preoccupying because we've not reached a 0% level yet. We still have persons who are infected. As I say, as at the last report that I got from the district, is 7%, but in Babungo village, about 5.4, if I have to go by the PMTCT program, out of 37, 2 positive.
Which is the age group that is being affected by the HIV/AIDS?
Yeah, in fact, the age group between 15 and 29 is the hardest hit. Is the hardest hit, because you understand that 15 to 29 years old, that's the most active age group. There are persons who like to move out and try things out. They have a lot of energy, and they don't think that death is within their program yet. So now the age group between 15 and 29 are the hardest hit. But again, generally, women are the most hardest hit, and children as well.
And when you look at the percentages that you've just given us,
yeah,
and you compare it to the rest of the region, what would you say are the causes of this high percentage in the Ngautinja division? Yeah,
in fact, as far as the rest of the region is concerned, right now we are very anxious to see to it that, we're anxiously waiting for another demographic and health survey to be carried out for us to have the current situation in the entire region of the Northwest. In fact, the situation in Ngautinja, the North Health District, is a bit exceptional because the North Health District, the prevalence rate is higher than in the other divisions of the region. In fact, as at the results I just cited, I think North Health District was still amongst the highest as such. Now, and the reasons are simple.
What is NEFI really doing to cut this transmission rate, the prevalence rate of HIV/AIDS in the Ngautinja division?
Yeah, the fight against HIV is our major preoccupation. We have lots of other activities. Now, what we do is that, in the first place, we move out to the communities and we try to empower the communities. In fact, as at now, we have trained in all 123 communities in the health district. And now we get to the community, we identify a community-based organization that is reliable, that is vibrant, and that is ready to work. And then we train them and give them the necessary tools they need to work. Secondly, we do give support to children, to orphans. Children who have lost either both or one of the parents, and then we assist persons who are HIV positive, and then we encourage the population as well to do to go to hospitals and the facilities around and do and find out their situation and know their status and do an HIV test. And then for those who are infected, we try to encourage them to get onto treatment.
And how do you work with these orphans? How do you work with them?
Yeah, with the orphans, in the first place, when we start off first of all by identifying the orphans. In fact, in 2004, we identified 10,700 orphans. And as at now, we're able to reach out to about 2,300 of them. So you can imagine the gap that is still left. So what we do is that we give them, first of all, psychosocial support. Now we try, first of all, for those of them who need counseling, we try to counsel them. You can imagine a child who just lost one or both parents is traumatized. We give them psychological support. And then we try to identify their needs. For those of them who have to go to school, we pay their fees, we buy their books, and then for some of them who don't even have birth certificates, we try to provide the birth certificates because that is the basic requirement, or the basic, you can imagine a child without a birth certificate, and it's a situation that's prevalent here. So now we provide all of that, and then we have our staff in the office that move out and follow up the support that we give to the orphans, and then the community-based organizations who have trained in the communities, they do a lot of follow-up of these children too, so that their livelihood is kind of improved upon. That's what we do.
You've enumerated so many things you're doing, and this needs a lot of money.
Yeah.
So how do you get these funds? Do you have foreign partners, and how your relationship with the foreign partners, if you do have?
Yeah, thank you very much. In the first place, we have the human resources that we have in the office here, the staff in NAFI, I mean, we have a powerful staff, I mean, a dynamic staff that's ready to sacrifice. They're doing quite a lot. And then it's because of this staff that we're able now to get in touch with partners who come in and work with us. So we have the first set of partners are the ministerial departments. We have the Ministry of Public Health. We have the Ministry of Social Affairs, then the Ministry of Territorial Administration and Administrative Reform. These are ministerial departments that work together with us and help us quite much to reach out. Then secondly, we have international NGOs, and they include the Catholic Relief Services, CRS. We have Voluntary Services Overseas, VSO. We have Plan Cameroon. Then we have Place of Hope, Charlotte, USA. Then local partners have to do with our other colleagues in the region who work in the same area, and then the community-based organizations that are out there. So now the NGOs particularly, they come and we sit down and we try to identify the needs in the field, and we see they give their own contribution, and we to give our own contribution. We put all of this together and see how to prepare a package, a complete package for the kids. That's how we work.
All right.
Yeah.
And what are some of the challenges that you face?
Yes, in fact, the biggest challenge we have is we have insufficient human, material, and financial resources to meet the requirements and the needs of a target population. In fact, I told you a while ago that in 2004 we identified 10,700 orphans, and we tried to streamline to the most needy. We came down to about 6,000, but we're yet only able to reach out to about 2,300. So imagine the gap that is still left. That's the challenge we have. And we have challenges especially also in the other areas, other program areas, because those address the needs, the health needs of children under 5 years, mothers of childbearing age, children in difficult circumstances, and then, in fact, the community-based organizations we have trained, we have challenges, I mean, trying to provide for them the means they need to work and work in such a way that the results are produced. So in short, what I'm saying is the difficulty is the insufficient human, material, and financial resources. Really insufficient. But the bit we have for now, we're trying to maximize use of the bit we have for now.
And our listeners, you all got it from Mr. Wang Roland, who is the coordinator of NAFI, and he talked to us. We all are in the fight of HIV/AIDS. Assist a widow, a widower, one orphan, just like the non-governmental organization, is in the fight against HIV/AIDS in our communities and in our society. Hello.